Thank you, Leanne, and welcome everybody to today's session. Just to give you a general overview of what we're seeing in Tulsa County now. Today, our newly reported cases for Tulsa County nearly doubles our previous peak from past cases. Today, we're reporting out 7,572 new cases amongst Tulsa County residents. Sadly, that includes 13 deaths as well. And of course, you can view more data, including our zip code map on the Tulsa Health Department website. Our recent 3-day average for Tulsa County hospitalizations is 341 individuals in the hospital, with 92 of those individuals in the ICU. And this is a metric that's really trending upward. A month ago, those numbers were 194 in the hospital, 78 in the ICU. The significant majority of hospitalized individuals continue to be unvaccinated. Our healthcare systems are operating with less staff than in previous surges, putting more stresses on our systems. They are well equipped to meet the needs of the community, but I'm personally concerned about continuing to stress the system. We've all got to come together and support our hospitals and do whatever we can to prevent exposure and infection. The layered approach that we've been talking about is still critical more now so I think than ever. It includes vaccines and boosters, masking indoors, frequent hand washing, testing, isolation, and quarantine remain essential to prevent infection and spread. Here we are now, nearly 2 years into the pandemic. Of course, we understand that people are tired and frustrated. I think everybody is experiencing the COVID response fatigue, but bottom line is that now is not the time to become lax and to say, forget about it, who cares? We've got to stay vigilant to slow the spread and do whatever we can to reduce the burden of COVID on our healthcare systems. Please, everyone, if you're out in public, wear a mask, and more importantly, wear the right mask. Cloth masks are no longer recommended. With Omicron, we recommend that you wear a surgical mask or an N95 or a KN95 to make sure that you stay safe. Avoid crowds if you can. Get vaccinated and boosted if you're eligible. Of course, stay home if you're sick. The Omicron variant is really rapidly moving through our community, as evidenced by the case numbers we released today. Our work with the University of Oklahoma and the city of Tulsa for wastewater surveillance indicates that 95% of the most recent samples collected were the Omicron variant. So we know Omicron is circulating at extremely high levels and very efficiently throughout Tulsa County. At home, self-administered rapid tests are not included in the reported case counts. So keep in mind that reported case counts for Tulsa County are actually under what we know is truly circulating throughout our community. And as always, PCR testing continues to be the gold standard for COVID testing. And again, if you develop COVID-19 symptoms, we recommend you get tested and stay home until you receive your results. Also, we are receiving anecdotal reports from the community and local providers that testing is challenging to find. There are many resources in Tulsa County for testing. You can view a list on our website. You can talk to your healthcare provider or visit our website to find testing resources. And please, use emergency rooms only for medical emergencies. Don't go to emergency rooms or hospitals for testing. Those facilities are there just to respond to emergency at that moment. Tulsa Health Department, we've expanded our testing to offer 3 days a week, and we have contracted with partners to offer testing 7 days a week, including a mobile option. And as always, appointments are filling up just about as fast as they can be added. So if you need a test, get on our website, and we know you can find a place to be tested. I'd like to turn this over to Ellen Niemetella right now.
Yeah, thank you all for being here with us to cover this very important topic. I really wanted to stress again just the importance of COVID vaccines to help prevent disease and prevent serious disease and illness and hospitalizations. So right now the data is still showing that the COVID-19 vaccines are the best way to protect against COVID and all of the variants, and that the booster shots have been shown to add that extra layer of protection and actually boost the antibody production so that the individual is more protected. So we want to make sure that both you and your family are up to date on your vaccines. So up to date would mean having the primary series of the Pfizer or the Moderna, or having the initial Janssen vaccine. For those that are immunocompromised, having that third dose of Pfizer or Moderna a month after the second dose, and then obtaining the booster whenever that time comes. A booster is recommended 2 months after the Janssen vaccine and now 5 months after the completion of the Pfizer or the Moderna series. The new guidance is regularly coming out from the CDC regarding the vaccinations based on what the studies are showing and what currently is happening in the community. And so some of those latest recommendations, again, are that boosters are strongly recommended for everyone age 12 and older. And the time frame for receiving that booster has been decreased down to 5 months for the Moderna and the Pfizer vaccines. Right now, Tulsa County has more than 300 providers who are administering COVID vaccines, which includes the Tulsa Health Department. So anyone age 5 and older can receive a vaccine. And again, anyone age 12 and older should receive a booster when that is time for them. And wanted to just also make sure everyone knows the COVID vaccine supplies are adequate. We have a lot of vaccine in the county and people should be able to get the vaccine. Those supplies are strong right now. Looking at some of the numbers, at this time, 72.9% of Tulsa County residents of all ages have received at least one dose of the vaccine, and 58.8% are fully vaccinated. So there still is some room for more individuals to get vaccinated. If we look specifically at the population age 5 and older, 78.4% have received at least one dose, and 63.2% are fully vaccinated. Again, those individuals under the age of 5 are not eligible for a vaccine yet. The other thing, 33% of the fully vaccinated individuals in Tulsa County have received a booster dose. So again, there still is some room for more individuals to be getting that added protection from the booster dose. So want to let you know too, the Tulsa Health Department, we continue to work with several community partners, including the Caring Van, to bring COVID vaccines and other vaccines out into the community, into different populations. So we are working on the mobile vaccine clinics and reaching out, like I said, to the vulnerable and minority residents. And the vans have already been out more than 6 times so far in 2022 and have administered several hundred vaccines on those vans. So I'm going to turn that back over to Leanne. Thank you very much.
Thank you, Ellen and Dr. Dart. I do have a couple of questions that I'm going to read that were submitted. The first question comes from KOTV, and I believe this is for Dr. Dart. Are there certain at-home tests Dr. Dart or THD recommends over others? Which are more accurate? I know PCR testing is the gold standard, but if people want to buy an at-home test, which one should they get?
So yes, PCR is definitely the gold standard now. You know, I don't ever want to be put in a position to recommend certain products over others. What I can say is that there's a nonprofit called ECRI, and this nonprofit exists strictly to focus on healthcare equity and cost effectiveness. ECRI did a review of the top 7 at-home rapid tests. So I would just go online and Google ECRI and get the results from there. That way, individuals can choose which ones they would like to purchase for themselves.
Thank you, Dr. Dart. The next question comes from the Tulsa World. With the Chili Bowl at Expo Square about to get underway, did the fairgrounds submit a safety plan to THD? And if so, does it include any requirements for masks?
You know, we're not asking for safety plans at this juncture, but we still encourage that if you're indoors, regardless whether it's a small or large event, that you do mask up. And of course, once again, we really recommend that layered approach of being fully vaccinated and up to date with a booster, wearing your mask in these indoor events to stay safe and prevent exposure both yourself and your family.
Thank you. Now I'll turn it over to Rick Marinon with Fox 23 for your question.
Just a few questions. Is this officially, I was looking at the zip code map, is this officially the worst it has ever been for Tulsa County since COVID came back in March 2020?
I think the data is pretty clear. I mean, we had our highest case count ever, over 7,000. I think our previous high was closer to 4,400. Every single zip code on our zip code map is in the dark red. So sadly, I actually think right now is our worst case scenario in terms of just pure numbers and virus circulating through our community, which it's what's happening all over the country. I mean, Omicron, we know, is extremely highly transmissible, and we're seeing the effects of that here as well.
So that being said, do you think the peak is going to come soon? Keith Reed told me by the end of the month. And with so many people getting sick, do you think we will finally reach herd immunity? And I've got one more after that.
And that's a tough question to answer, because we have no idea if there'll be more variants that evolve from Omicron. We do know that Omicron, as I said previously, is transmitting very effectively, and we know how highly transmissible it is. So, there is, if you look at all the modeling, it really varies. I mean, we could peak by the end of January, we could peak by mid-February. We really and truly don't know, but I would expect some kind of peak in the next 4 to 6 weeks.
And my final question, I know there's other people in line. I'm sure you all have seen the line at St. Francis Broken Arrow and everywhere else. Is there anything being done to try to lower the wait times at these lines, or is there some kind of tool that I can use to find the shortest wait time? But I mean, we're dealing with 3 to 6 hours in some cases, just so people can get tested.
I think us and many other facilities have expanded testing as much as our capability will allow. And I think, as we all know, the demand right now is incredible. And I think as a community, we're trying very hard to meet that demand. And I think we have to be patient, because wait times are going to be included in going to get a test. And that's just in the whole, bottom line with economics, supply and demand drives everything. And right now, demand is huge. And as Ellen had said earlier, the supply is there, but when demand is this high, people are going to be waiting. And I don't know how we get around that, to be perfectly honest.
Thank you. Next, we'll go to Chris with KWGS.
Thank you so much. My internet's going in and out, so I apologize if I drop off. I heard, Dr. Dart, you say we were at 341 county hospitalizations, I believe. Is that an all-time peak, like cases, or are hospitalizations still below?
So that was our 3-day average. And I know that we're getting pretty close to I think data we saw like last year at this time. So I don't think we've exceeded our worst from last year yet, but we're much earlier into the new year. So it's disconcerting to see our 3-day average there where it is. I don't like the fact that we have so many people in the ICU. So people have got to continue to follow that layered approach, so that our healthcare systems are able to make it through this current time period. Because remember, we're also in the middle of flu season. So whatever people can do to prevent exposure and infection is extremely critical that they follow those recommendations.
Thank you. And again, I apologize if you answered this already. What sort of locations or environment are the majority of cases coming from or attributed to? I know earlier in the pandemic, you've given kind of like a top 3, like education settings or so on. Do we have that information now?
No, we don't. And primarily, Chris, because it is just everywhere. And I think it's really difficult with the high number of cases we're getting to pinpoint specific places. I mean, it's no matter where you go, I think people need to know that there's potential. If they're going out into the public, more than likely they're going to be exposed to somebody with COVID. And that's just where we're at today.
And this is my last one, what has been your advice to school districts now that are struggling to stay open? I mean, if COVID's everywhere, then kids and teachers and staff are going to get it at schools, I assume.
And that, I think that's the reality. Right now, we know all the schools are facing it, and I think schools are doing a tremendous job to try and ensure that they can continue to educate their kids and as much in the classroom as they possibly can. But COVID is circulating. We still have, and so that I think the potential for closures, whether it be schools or other businesses, is going to be there while we're in this period of high transmissibility.
Thanks so much.
Thank you. Next, we'll go to Amanda with KJRH.
Hi, thank you. Some people have already kind of covered some of my questions, but I wanted to touch on a little more about the testing availability. It sounds like you guys aren't having any issues, but I did speak with OSU Medical earlier this week, and they said they have low testing supplies and that they're trying to have to kind of ration out who to give it to. But you guys say you're not having any issues with that, correct?
THD is not, and I know that different facilities might be in a different place. So, Ellen, do you have any more information on testing capacity? We know that right now, testing demand is being fulfilled even with the long waits. And I am hearing from a couple outlets saying that they are concerned about supplies, and we know there's been supply chain issues, but at this juncture, we're still able to meet that demand. But Ellen, any more comments from you on that?
No, thank you. I agree. Pretty much all of our area labs and facilities are able to do the testing. However, there may be a little bit longer turnaround time in order to get the results, simply because the labs that are processing those tests are just working as hard as they can to get those out. So just because the numbers are so high, there might be a little bit of a delay with that. We also anecdotally are hearing that the over-the-counter tests that people can purchase are in short supply and are limited. So we're seeing some of that. But if you look at the case number, the number of people who are testing positive and those that are requesting testing, it really is an unprecedented high number.
And what can you guys say to those who are sitting in these lines for hours on end just to get tested and then having to wait days on end to get a result as well? I mean, people are just very frustrated, all trying to do the same thing.
And unfortunately, this is where we are today. And bottom line is that if we continue to recommend that people follow that layered approach so that they're safe and as safe as possible when they're out in the public, so that we can limit exposure and, more importantly, limit infections. But right now, with the high level of transmissibility of COVID, I don't know what to tell people to make them feel better, because demand is extremely high. All of our stakeholders and partners in the healthcare world are working so incredibly hard to meet that demand, and we all have to understand that this is where we're at today, and this is not the way it's always going to be, but this is the way it is right now. And we ask everyone for their patience, and to know that everyone's doing their best to meet their demand, and this is what we're seeing today. And until that demand goes down, this is where we're at.
Okay, two more quick questions.
Can
You had
I just
touched.
add, Amanda?
Yeah.
Sorry, can I add just a little bit onto that? We strongly would encourage any individuals who are seeking testing because they are symptomatic to go ahead and isolate, stay home until they do get those test results, even if there is a little bit of a delay until they get the results. So isolate for those individuals that are symptomatic, and also looking at the quarantine. So if someone has had close contact with someone who is positive, we do encourage those individuals to quarantine. And the quarantine recommendations have changed just a little bit. So even individuals who are vaccinated but not boosted should consider quarantining if they have been in close contact with someone who does have COVID, even though there is that delay in getting those test results. So just doing that to protect yourself and to protect those around you.
Got it. And then you guys did touch on the peak question, but to add to that, I have been made aware that Oklahoma's kind of peaked a little later than other areas. It's kind of been a delay or peak for us. So, I mean, is that going to be the case this time around too, or could we peak with kind of other states as well?
Amanda, we honestly don't know until what happens is actually happens. So, we've always been a little delayed. It seems like compared to other parts of the country, as the virus moves across the country, I wouldn't be surprised if we see a similar reaction to where we currently are. But it's really difficult to say definitively that what you expressed is what we're going to see here. All we know is that right now we have extremely high levels of circulation. And more and more people are being infected.
Hey, Amanda, we're going to move on and we can come back to you for your other questions. Next up, we've got Skylar with KRMG.
Hey there. My question is for Dr. Dart. We've all heard that Omicron is less serious. And I think in some cases, people mean that they take that as not serious. And we still have so many people in the hospital. And you mentioned the record number of new cases. So two-parter, can you first speak to that it still can be serious? Look at the spread and the percentage of people ending up in the hospital. And then number two, can you elaborate a little bit on what serious illness looks like with Omicron? I've heard things like, it not affecting your lungs as much as previous variants.
And so Omicron is, very, very serious. And yes, what we've seen so far is that it seems to go into the bronchial tubes, but not into the lungs, which is why the level of acuity isn't as high as with Delta or some of the other COVID-19 strains. So when we say that it's milder, it doesn't mean it's milder for everybody. And that's what people need to remember is that with the sheer proportionality and number of people getting sick, there are some people that this will not be a mild illness for, especially people who have chronic conditions or immunocompromised or are older. And that's why we're seeing our hospitalization numbers go up. So while for many people this could be mild, this is certainly not a mild illness for everyone. And as we talk about that individual effect, we talk about the population effect. That's where we see the huge number of cases and hospitalization. So I think people shouldn't put too much weight on that. This is a mild illness because we don't know who it's mild for. And the bottom line is that, I'm getting people sending me messages through Facebook and other places saying that people are having Omicron parties to get exposed. Well, don't do that. Absolutely do not do that. We know that this makes many people very, very ill, and that's evidenced by our number of cases and our number of hospitalizations and our deaths as well. So mild is kind of a relative term, and nobody wants to find out for themselves if they would have a particular mild case or not.
Thanks. Next, we'll go to James with KTUL.
Hi, thank you guys for holding this meeting today. Firstly, I just wanted to go back to testing real quick. I believe when I checked in with you all before the new year, you all were doing around, had the capabilities of doing around 70 tests a week. What are those capabilities now that you have expanded, and when did that expansion take place?
Ellen, you want to give the specifics around that?
Yes, the Tulsa Health Department did start expanding and offering testing on additional days last week, and we are scheduling up to 120 appointments every day. There are several that are not showing, so we have even added another hour onto the testing clinics for the last couple of days. So we really have increased our capacity. So we're up to probably about 400 capability of testing a week, and that would be the number of appointments that are available.
Thank you. And then obviously last year during our last surge, we, in talking with you all and Dr. Dart, it was always, you wanted to continue to push the vaccine instead of protocols. In having discussions with the mayor and city council, can you share some insight into what those discussions have been like? And now as we exceed our previous peak, has there been any talks of any sort of protocols? I know you said that you aren't taking safety plans from events like the Chili Bowl right now. Has there been any thought in the need of needing to do something like that?
I'm getting asked this question really quite a bit, and my response to that is that I don't think we need a mandate to wear masks. I don't think we need a mandate to get vaccinated, and we've got to start hopefully doing those right things to prevent transmission and prevent exposure to infection. And we're all responsible adults here, so mandates shouldn't require us to keep ourselves safe. And so that's why we recommend that everyone wear a mask in public, be vaccinated and boosted if you're eligible. And we shouldn't have to put a mandate out to require you, I think, to do that. And that's my own personal perspective. And then we've had this conversation with mayor and city council, and they're aware of where we're at, and they know that I think the situation that we're dealing with in the hospital. And I know the mayor talking to the hospitals on a really regular basis. So, but bottom line is that we're asking everyone to do the right thing, and the right thing is to stay safe. And you stay safe by wearing masks in public and being vaccinated and boosted if you're eligible.
And then one last real quick follow. I may have missed it earlier. I don't know if it was mentioned, but the fourth booster dose for immunocompromised individuals was just approved. Are you all, is there a day when you'll start scheduling those, or is it just as people figure out that they're eligible, they just go in and schedule their booster?
Yeah, we're administering the fourth dose to those that got the third dose because they were immunocompromised. We've been doing that ever since that approval came out. So again, immunocompromised individuals get their third dose of the Pfizer or the Moderna 1 month after receiving their second dose. And then their booster is 5 months after their third dose.
Thank you. Next, we'll go to Corey with Tulsa World.
Thank you. I appreciate you all doing this. I was hoping you might be able to walk us through what the R naught value is right now in Tulsa County and kind of what that is and how comparatively bad it is compared to the rest of the pandemic at this point.
You know, Corey, I can't speak specifically to what the R naught rate is in Tulsa County. I can tell you what the scientists are telling us what the R naught rate is for Omicron. And for those who don't know, R naught means the number of people one person can infect. And it looks like the R naught rate for Omicron nationally is about 10 infections per one person who's infected. So that's extremely high. As you recall, early on in pandemic, R naught rate was around 2.5 to 3. It looks like Delta has been close to that 5 to 7. So right now we're seeing the highest R naught rate with any variant that we've had. And that's evident in our case numbers.
Thank you. And then I was hoping you might be able to kind of describe what's happening in Tulsa County hospitals, what they're telling you, what you've heard, how overwhelmed or burdened are they at this point?
They're very overwhelmed, very burdened. And I think, the vast majority of the patients that they continue to take care of in the hospital are unvaccinated. I think that's really a qualifier that we all need to pay attention to, because I think there might be some confusion with people thinking that if they got vaccinated, then they were fully protected against being infected. Well, being vaccinated really protects you against being hospitalized, because we know that vaccine is not 100%. So it's important that you do your part to stay safe, and once again, not add to the burden of healthcare systems. But healthcare workers get sick like everyone else. And so in addition to staffing shortages, our healthcare systems are also experiencing their own workers who are being exposed or infected and then being held out and not being able to be there to take care of patients. So, all that we can do to limit that burden on healthcare systems are things that we actually have to do so our hospitals can maintain viability. Because remember, the people in the hospital aren't just there for COVID. There's other issues that people are needing hospitalized as well. So our healthcare systems are burdened right now, and we have the ability to limit that burden on them, and we all have to do our part.
Thank you.
Rick with Fox 23, I think you had another follow-up.
Is the COVID, I know it is so new and just the first ones are coming off the assembly line, but are any of the COVID pills in Tulsa County right now? And if so, who would qualify for them? Do you get them from the state and then you administer to the hospitals? How would all this work?
So they're actually the state, they do come through the state, and the state makes them available to physicians and pharmacies. And because we've had a lot of people reach out to us asking for the information, and we refer them to OSDH, who's got the list of all the entities that have that medication. And we know just right now, COVID antivirals are in short supply. Monoclonal antibody is also in short supply. So it's important that those resources go to those people that need it most. And that's why it's being distributed to the state. So it goes to those who are most in need.
Does THD itself in its building have sotrovimab, or do you have the ability to administer that, or do you just leave that up to the hospitals and such?
No, we don't, Rick, and that is up to the physicians, healthcare providers, and hospitals to distribute to their patients.
Emery with KOTV, you had a question?
Dr. Dart, do you have a good gauge on how many tests are actually being administered, and even a ballpark idea of how many are outside the system of reporting, the home test or third parties that aren't plugged into the state system and reporting their cases?
We know how many we test, and we get reports from the PCRs about with all of our partners who are all full testing. What we don't know is how many rapid tests are out there being used and testing positive, because we're pretty sure that many people who are testing positive rapid aren't being confirmed with PCR. And, I heard Dr. Dale Bratzler, who's the OU COVID chief, say, I think just yesterday, that to really get a feel for what our case counts truly are in Tulsa County, multiply that number by 3. And then we'll have a really good feel for how many infections we actually have. So that's really elementary and not, I would say, exactly scientific, but it lets us know that we have a much higher number of infected individuals in Tulsa County than what's shown up in case counts.
Okay, thank you.
Next, we'll go to Anna with Tulsa World.
Thanks so much. I wanted to ask whether local school administrative leaders have been reaching out for guidance as their staff are coming infected about isolation and quarantine and their decisions to go to distance learning, or are these decisions mostly just coming from purely the numbers? Can you talk about the challenges that they're facing and trying to stay in the classroom?
Absolutely. And the schools, I think, are doing a tremendous job under extremely exasperating circumstances. And we have made, of course, the CDC guidance around quarantine and isolation and exposure available to all the schools. We actually had pretty detailed email exchange with them last week. And we talked to the Tulsa County Superintendent Group fairly regularly. So we understand that, their burden is that their teachers are getting exposed, they're getting sick, so they're not there for the classroom. So class can't be held in person. And all the schools at this juncture are dealing with that. I think schools are doing their best under these extremely trying circumstances, but they are following CDC guidelines, and which is one of the reasons why they're going virtual or in the classroom. I think they're following those guidelines very strictly so that they can be more in the classroom than out of the classroom.
Thank you. Amanda with KJRH, did you want to ask your question?
Yeah, 2 quick questions. So I'm curious if you guys know what the ratio of vaccinated people are that are getting COVID right now. Like what, for example, Las Vegas is reporting that 4 in 10 cases are vaccinated people. Do you guys have any statistics like that?
No, we don't. We have some anecdotal information about the number of unvaccinated in hospitals. I don't have any data that is telling me how many unvaccinated people are actually getting sick or vaccinated people getting sick. So not data that we've been collecting. Ellen, do you have anything on that?
I don't, but Kelly, I'm not sure, or Monica, if any of the epidemiology reports might be showing some of those breakthrough cases.
I don't have specific numbers on it, but I can tell you that through some epi investigations and individuals calling in, we are seeing breakthrough cases of individuals who are up to date on vaccinations, who are testing positive. So we know it is occurring in the community. We don't have that exact number of what that looks like compared to the overall ratio of individuals that are testing positive, but it is occurring in the community.
Okay, I just wasn't sure if we knew how much it was happening. And then my other question is, are you guys seeing kids coming in with COVID on top of other illnesses, say RVS or something else?
And Amanda, that's starting to be, I think, a real issue that we're seeing. Hospitals right now are seeing more patients who are inadvertently testing. They're coming in the healthcare system for other issues like RSV. They're testing out all their patients just to make sure that they're safe, and they're finding cases that way. So we're starting to see that be a factor.
Next, we'll go to Chris with NPR.
Hey, thanks. Do you have any sense of kind of, with cases at the highest rate ever, how many of these folks are going to have long COVID to deal with, other downstream sequelae of just, how much of a burden is COVID going to cause on the health system, for years to come?
Chris, we really don't know. I mean, and we can, anecdotally know that for many people, long COVID has been a huge issue and huge concern. What that means in the aggregate going forward for all those who test positive at this juncture, it's really too soon to tell. But we know that long COVID is, for many people, has been an issue and continues to be an issue. As time progresses, I think we'll get a better feel for what that truly is.
Thanks.
Rick with Fox 23.
I was just wondering if I could get a clarification on something on the zip code map. I'm noticing on 74110, that is, and 74115, those are still heavily populated areas, but the numbers are down just a little bit. Are you having problems with people getting tested as you were with those initial efforts to get the vaccine out in those areas of North Tulsa? Are some of those people reluctant to come forward, or do they feel they don't have the stuff to get tested? Just those health disparities we've often seen.
You know, Rick, I honestly don't know. I think it's really too soon to tell. And excuse me, I haven't looked at our zip code. We just updated right before we went on air, so I haven't had a chance to look at it in great detail myself. But those are things that every time we update it, we look at to see if there's variables like you mentioned with health disparity that's contributing to either testing or lack of testing in certain parts of our community. So that's something I was trying to do actually when I got to this call. So I really can't answer that question now.
Thank you. I appreciate it. That's all my questions. I'll shut up now.